Hi, my name is Dr. Apazidis. I'm an orthopedic spine surgeon practicing at 57 and 7th Avenue in Manhattan, New York. Patients should not be overly concerned about, is it worth it to come see a spine surgeon? I would be more concerned that someone has waited and perhaps delayed the treatment, and it could possibly lead to sometimes irreversible consequences. So in my opinion, you certainly would not have to wait until it's an emergency or you can't walk or you can't feel your legs or your hands. I think the right time to see the specialist is if you're having pain or if you're feeling something that you feel is just not quite right. In many ways, that's up to us to determine and help you with, to say, this is going to be okay, and we can reassure you and we can monitor along with you. Or we can say, you know, this is a little more concerning to me. I'm going to get an MRI, or I'm going to get an EMG test, or I want to, follow you a little more closely, and I'm going to also warn you about what to watch out for, symptoms that you should be concerned about. I do find, some patients are very in tune to their symptoms, to what they're feeling, to their bodies, and some tend to ignore things. And it can be a little dangerous, particularly in our field where we're dealing with the spine, we're dealing with the spinal cord, with nerves, neurologic disorders, nerve damage, and some of these things can be irreversible if not addressed in a timely fashion. So I would certainly not say that you need to feel that it's an emergency and that's when you're going to come see the spine surgeon. And you shouldn't be scared of the word spine surgeon either, because I would say 99% of the patients that I see do not get surgery and will never get surgery. And what I'm there for is to explain, to diagnose and treat many times with non-surgical techniques and treatments, and really reassure the patient and make sure that they never get to a point where they do need spine surgery. The other issue with timing of when to see the spine surgeon is that, yes, surgery is a last resort, certainly, but sometimes delaying surgery allows conditions to deteriorate to a point where we have fewer options. The most options that we have, obviously, is early on. And there are many different types of techniques that can be applied that are more minimally invasive, faster recoveries. If things are allowed to deteriorate past a certain point and they become emergent, sometimes our hands become tied and we have fewer options available for treatments. Surgeries can become more complex, needlessly increased risk of procedures. So for those reasons, I would prefer to see a patient right from the beginning. If they're feeling something, if they were playing a sport that they've been used to playing and it seems to not be working out for them, or things have changed, or things at work are not working out the way they typically do, then I want to see that patient early on, do the right evaluations, examine them, and make sure that we're not missing something more profound. To find out more about orthopedic spine surgery or to seek a consultation, please go to my website, www.totalspineandsportscare.com.